Good afternoon, and welcome to the second session in the Center for Environmental Health's 6-week Maternal and Child Health webinar series. It is great to see many of you from last week back again, and to see some new attendees as well. We at the Center for Environmental Health envision a world where everyone can exist in healthy environments, and this webinar series speaks directly to our mission as an organization, which is to provide tools and resources that can be used to protect the public, communities, and families from toxic chemicals. In this series, we are focusing on unconventional natural gas extraction and development, otherwise known as fracking, and exploring the potential health impacts for women of childbearing age, pregnant women, and infants and children. We are pleased to have with us today Dr. Jerome Paulson. As a nationally renowned expert on issues relating to the environment and its impact on children's health, including hydraulic fracturing, Dr. Paulson will be speaking about the unique physiology of children and the potential health implications of unconventional natural gas extraction for infants and children. Dr. Paulson is Professor of Pediatrics at the George Washington University School of Medicine and Health Sciences and Professor of Environmental and Occupational Health at the George Washington School of Public Health and Health Services. He is a medical director for national and global affairs of the Child Health Advocacy Institute and director of the Mid-Atlantic Center for Children's Health and the Environment at the Children's National Health System. He is also the chairperson of the Executive Committee of the Council on Environmental Health for the American Academy of Pediatrics. He served on the Children's Health Protection Advisory Committee for the U.S. Environmental Protection Agency, and he was a recipient of the Soros Advocacy Fellowship for Physicians from the Open Society Institute and worked with the Children's Health Network. He has also served as a special assistant to the director of the National Center on Environmental Health of the CDC, working on children's environmental health issues, and has served on numerous boards and committees related to environmental health, as well as published, edited, and book chapters and journals on the topic. So welcome, Dr. Paulson. We are thrilled to have you with us here today, and I will now turn this over to you so that you can begin your presentation.
This is Jerry Paulson. Good morning or afternoon, depending upon what time of day it is where you're located. I'm glad to have this opportunity to be with you this afternoon, and we'll go ahead and get started. So, as was mentioned, I'm the director of the Mid-Atlantic Center for Children's Health and the Environment, and this is one of 10 pediatric environmental health specialty units in the United States. And the Mid-Atlantic Center is indirectly funded by the Agency for Toxic Substances and Disease Registry and by the EPA. However, they don't review what I say, and I do not, what I say does not represent their policy. So I'm going to talk about kids and some differences between kids and adults, and then talk about natural gas extraction using high-volume slickwater hydraulic fracturing from long laterals from clustered multi-well pads. And I'm going to shorten that to unconventional gas extraction because if I use that phrase, that's all I'd say all day. We're going to talk about some of the toxicants involved and some of the health hazards that are either suspected or known to occur as a result of exposure to unconventional gas extraction. So first of all, in terms of children, kids, in one sense, it should be self-evident. Kids are not little adults, but it's important to tease out the different ways that they are not little adults and how those ways impact on their interaction with the environment and the effect of the environment on their health. Kids, by definition, live longer than adults. And one of the implications of that is if something happens today and the outcome is 40 years from now, depending upon the age of the adult, they may or may not be around 40 years from now. But for a child, they are likely to be around. And it's very important to recognize that many outcomes of environmental exposures do not occur immediately, but rather do occur days, weeks, months, years, decades down the line. Kids eat more, drink more, and breathe more per unit of body weight than an adult does. So if the food that they eat, the water that they drink, or the air that they breathe is contaminated, they get a higher dose of the contaminant than an adult will. And as far as unconventional gas extraction is concerned, we're mostly concerned about drinking and breathing. Food doesn't play a very big role. And then kids metabolize chemicals that come from the outside of their bodies in ways that are different than adults and in ways that sometimes make them more likely to have an adverse consequence of that exposure. So we need to think about children and environmental exposures actually starting before conception. We need to think of those men and women and the exposures that they have before they have even conceived a child, because exposures to men and women prior to conception can influence the sperm in the men and the ovum in the women, and therefore influence the health of the child who's born after conception. I think everybody's familiar with issues of in utero exposure to chemicals, problems with medications that the mothers might take, excessive alcohol consumption by the mother, various things like that leading to birth defects. But there are periods of vulnerability that really extend throughout childhood. The brain finally finishes its developmental evolution somewhere in the early 20s. So we're talking about exposures that can occur throughout the entire time of childhood. One other thing that's important to recognize in the context of these exposures, again, we're used to the notion of exposures in utero having adverse outcomes. But think about lead, a very common toxicant in children, but it's also a toxic substance for adults. When kids are exposed to lead, the adverse outcome is primarily within the brain. And when adults are exposed to lead, the primary target organs are different parts of the nervous system, the peripheral nervous system, not the brain, and liver and kidneys. For Caucasians who are exposed to ultraviolet lights enough to get 5 blistering sunburns prior to adulthood, their risk of developing malignant melanoma, the most serious form of skin cancer, is tripled. But sunburns during adulthood do not increase the risk of development of malignant melanoma. So again, the time of exposure makes a difference in the outcome. And while we know some things about what happens in utero and in early childhood, there are many exposures that occur during puberty, during adolescence, a time of radical changes and rapid changes in the human body, and we don't know a lot about the impacts of environmental toxicants on the human body at that time in development. So we worry about exposure to air pollution during unconventional gas extraction, and I'll talk a little bit more about that. But one of the reasons that we worry about it is that the lungs continue to develop not only in utero, but until a child reaches his or her adult height. So that's usually a little younger in girls than in boys, and can be anywhere from early teen years to late teen years. But the breathing tubes, the windpipe in the neck, and the tubes that branch out from that continue to branch, and then the alveoli, the portion of the lungs where oxygen goes in and to the blood and carbon dioxide comes out, continue to develop during childhood. The endocrine system, there are endocrine disrupting chemicals that are potential, that people can potentially be exposed to through unconventional gas extraction. And so development of the endocrine system is extremely important. Obviously, it occurs at a different pace in females than in males, and the development begins in utero and obviously takes radical changes during puberty, and those changes continue until full maturation in late teen years. So now let's turn to, now that we have some sense of kids in development, albeit very limited, let's turn to unconventional gas extraction. This is clearly an issue here in the United States, but as you can see on the right-hand side of the image, there is potential for exposure to unconventional gas extraction throughout the world. So what is unconventional about unconventional gas extraction? On the right-hand side of this image, you see a drill rig and a pipe that goes down into a gas, or it could be oil really, as well, reservoir in the ground. And basically there's a collection of gas underground, and you stick a straw into it, and the gas or the oil comes out without much difficulty. But on the left-hand side of the image, you see part of what's involved in trying to recover gas from shale. Think of shale as a petrified sponge that's made out of rock. So there are billions of little chambers within that sponge, and you need to break as many of those little chambers as you possibly can in order to get the gas, or in some instances the oil, out of there. So if you just put a straw, if you just put a single pipe into that shale, you're not going to break very many of those little chambers, and you're not going to get very much gas and oil. So you have to drill downwards, turn to the left, turn to the right, set off little explosions that crush that rock, and then you start to get commercial amounts of gas or oil coming out. The industry talks about fracking as having gone on for a long time, and part of what they say is right. Vertical fracking has been done for a number of years, but what we're talking about in unconventional gas extraction is vertical drilling and then turning the drill so that it runs horizontally for up to a mile, and then fracturing that rock segmentally underground. And that process has not been around for many years. There are a number of steps in unconventional gas extraction: pad construction, drill setup, the drilling itself, the fracturing, the natural gas extraction, well decommissioning, and land restoration. In terms of human health impacts, I'm primarily concerned with what goes on during drilling, fracturing, and extraction. The other steps do present risks primarily to workers and not quite so much to people in the community. It's important to recognize that you need many, many drill pads relatively close to one another in order to crush that rock underground. So on the right-hand side of this image, you can see 4 drill pads, some roads that connect them, some areas where drill pads are yet to be developed. And if they drill down from this well pad and then turn and run the drill out about a mile, that's as far as they can go. So they need to then drill from this well pad down below and move the drill horizontally to the area above and get much more of the rock underground. So again, going back to this image, you can see the need for turning the drill laterally and going horizontally. And they can do this in many different directions from a single well pad. And the image that you see here on the right is our drill bores superimposed on a map of an area near Dallas, Texas. The triangles are where the drill pads are, and then the colored lines are where the horizontal well bores go out laterally. And you can see they are trying to cover as much of that underground area with these drill bores as they possibly can. Here you see a picture of a drill pad setup. Some of the drill pads that are being set up today are less likely to have wastewater impoundments on them. Depends on the state where it's being done. Some places are using closed collection of the water and putting it into tanks when it comes back above ground, as opposed to putting it in these open pits. That is certainly better, but there's still many pads out there that have open wastewater impoundments ponds. And you've got a lot of trucks on the site. You have a lot of diesel generators, storage trailers, and the like. It's also important to see how close some of these pads are to homes and how big some of these pad sites are. This is a photograph that was taken in Pennsylvania. These are not small houses. These are pretty good sized homes. And you can see that the drill pad comes very close to the homes, and the size of the drill pad dwarfs the area immediately surrounding the homes. So I need everybody, please, to pay some attention to the details of this slide, because I'm going to refer to it a number of times, and I want to go over the various parts. Let's start in the upper left-hand corner. There are tank trucks that bring water and other liquids to the pad site. There are other trucks that bring sand, steel pipes, the drill rig, people. So there are many hundreds of truck trips that are required to establish and maintain a pad. Immediately to the right of that is a pumper truck, and that is the truck that has a diesel pump on it that is used to pump the fluid at very high pressure into the wellbore underground. And there may be multiple pumps on a single well pad. This particular diagram has the drilling rig has been removed, so there is just the top of the well, and then below it you see the well bore with casing around the piping. The well bore goes down, in this case, to a level below 7,000 feet, and then turns horizontally and may go out for another 5,000 or more feet. If we go back up to the top, next to the wellhead, you'll see the pit, and then next to that, you'll see trucks that are involved in taking wastewater away from the site, and then the storage tanks, compressor stations, and pipelines that move the gas to market. Underground, explosives are set off in these pipes that fracture the shale rock. Sand that's mixed with water and other chemicals and pumped down acts to keep those fractures in the rock propped open, so it's sometimes called a proppant, and then the gas, along with some of the water and chemicals that have been pumped down, go back up above ground. So where does air pollution come from? Many different places. As I mentioned, there are large numbers of trucks that bring equipment to the pad and trucks that take waste from the pad. There are trucks that bring and take people, or buses or cars that take people to and from the pad. There are those diesel generators, and diesel equipment results in exhaust consisting of particulate matter, oxides of sulfur, and nitrogen. And when those things get into the air and are combined with sunlight, they generate ozone. The particulate matter is a pollutant in its own right. The EPA published these estimates of the number of truckloads that it takes to get sand and water to the pad sites. And while some people say that the truck sizes that they used in this estimate are unrealistically small, and that means that it takes an unrealistically large number of truckloads to get the material to the pad site, nevertheless, whatever estimate you want to use, it's still a lot of truck trips. For example, bringing the pipe that goes into the well. These pipes come in 48-foot lengths, and I don't know how many pieces of pipe you can get on a truck, but let's say you're going down 1.5 miles and then turning right or left and going 1 mile laterally. That's 48 feet per section. That's a lot of sections of pipe that need to be moved. Another source of air pollution is these containment ponds, particularly if, as in this case, they are very large and they contain what are known as misters. If those of you who've had kids who've had croup or other kinds of stuffy nose or things like that, and if you've ever run a vaporizer in their bedroom, well, these misters are vaporizers, except they're the size of the house, not the size of one that you would use in the bedroom, and they put the water into the air to help it to evaporate, but they also put sand, any chemicals that are dissolved or suspended in the water into the air. And so the sand and the chemicals then get blown away into the surrounding area, depending upon the pattern of airflow around the impoundment pond. The natural gas that comes up from underground, what we burn in our homes, is the methane, or CH4, but rarely is that the only substance that is in the shale rock underground. The natural gas is often mixed with what are abbreviated or referred to as the BTEX chemicals: benzene, toluene, ethylbenzene, and xylene. Sometimes there's hydrogen sulfide. So if you think back to chemistry lab when you were a kid and burning sulfur and that awful rotten egg stink that you experienced, that's hydrogen sulfide, and so that can come out of the well also. In the processing of the gas above ground, these other chemicals are removed, and it is the methane, or CH4, that is sent to market. When the well is first completed and flowback first begins, the mixture of the methane and other chemicals is released directly to the air. Then, once they start to capture the gas, depending upon where the process is being done and what chemicals are the primary product that the industry is looking for, they may burn other of the chemicals in what's known as flaring, and that too can then cause its own air pollution. Once the methane is entered into storage tanks, compressor stations, and pipes, it leaks out into the atmosphere. Not as much as when it's released directly from the wellhead, but nevertheless some release is released into the atmosphere. So in addition to the precursors of ozone, the particulate matter, the methane, and the other volatile organic compounds, depending upon where the wells are drilled, there may also be radon trapped underground that comes up with the natural gas. The amount of radon is going to vary from well to well because it depends on the rock formation that that particular well is drilling into. And this is just a schematic to emphasize what I said a moment ago. Oxides of nitrogen with volatile organic compounds, and that's a class of compounds like methane, benzene, etc. Oxides of nitrogen with volatile organic compounds in the presence of sunlight form ozone, which is a major air pollutant and has the potential to damage the lungs of both children and adults, exacerbate asthma in those who already have it, and cause problems with other pre-existing lung diseases like emphysema in adults. This particular table here emphasizes some of the problems that are associated. You can see the X's underneath ozone on the left-hand side of the image, and the X's related to particulate matter on the right-hand side of the image. One of the things that does not apply to kids, but that I want to really emphasize because it is so important to the population as a whole, is the association between exposure to particulate matter and deaths or hospital admissions from stroke or heart attack. There is an almost linear correlation between measurements of particulate matter and admission to hospital or death from stroke or heart attack in adults in cities where these kinds of measurements have been made, and there's certainly no reason to think that particulate matter in rural or semi-rural areas would have any different effect than it does in the cities. Another set of research looking at prenatal exposure to airborne benzene. None of these studies were done in unconventional gas extraction sites, but again, there's no reason to think that benzene from automobile exhaust is any different from benzene that comes up underground when it's mixed with the so-called natural gas underground. And I want to emphasize that none of these studies show a cause and effect relationship. They show an association between exposure to benzene and neural tube defects. These are birth defects of the spine, where part of the spine is open to the outside of the body, sometimes called spina bifida. And these kids often have paralysis of their legs, or if the opening is higher on their back, they may have paralysis from higher levels going down. A study done in France looking at women living near roads showed that the closer the women live to the roads, and therefore the higher their presumed benzene exposure, the smaller were their babies for the number of weeks that they had been in utero. And then a study from Texas looking at kids living near refineries and showing an association between exposure to hazardous air pollutants from the refineries, which again would be very similar to some of the hazardous air pollutants coming from the unconventional gas extraction sites, and the development of leukemia in the children who live near the refineries. There's a very nice but as yet unpublished study using some data from Pennsylvania, Hill, looking at birth certificate data from Pennsylvania, and showed that babies born to mothers living closer to unconventional gas extraction wells were more likely to be born small for gestational age, so that goes along with some of the other association studies that show that exposure to benzene is associated with small for gestational age. And small for gestational age is sometimes a predictor of later developmental problems in childhood. So that's why we pay so much attention to the size of the children at the time they are born. And then this study by McKenzie and others is a study looking at unconventional gas extraction in the western part of the United States, looking at birth outcomes, looking at the association of pregnant women's proximity to wells, and then data collected on birth certificates. So again, data like height and weight and head circumference and gestational age. What they, excuse me, what they found was that kids born after their mothers lived closer to wells, the children had a 30% increased risk of a heart defect. Again, a correlation and association with those neural tube defects that I mentioned. And interestingly, in this study, no association with low birth weight. Now, when research is early, just first several studies coming out, it's not all that surprising to see some differences in results from one study to another. And clearly, one of the biggest problems with the whole unconventional gas extraction arena is a lack of outcome studies. So one of the things that was discussed very early on when unconventional gas extraction started to occur was, is this process causing contamination of wells, underground aquifers, surface water like lakes and streams? I don't know how many videos there are on YouTube of people being able to light their tap water on fire from methane. That doesn't certainly show a cause and effect between unconventional gas extraction, but it is a lot of anecdotal evidence that means more detailed research needs to be done. We're worried about the materials that are pumped into the wells. We're worried about materials that are underground other than the components of the gas that are dissolved by the hydraulic fracturing fluid and then come back up. I've mentioned radon, but there are also a lot of salts that are underground. The question is, how can material that is a mile or more underground get to the aquifer, which may be only a couple of 100 feet underground? Does it migrate from the fractures that were induced by the explosions all the way through a mile or more of rock and earth? Or does it come out through leaks around where the pipe, the well bore, goes through higher levels of ground? To some extent, it doesn't matter. I think there is growing evidence that both groundwater and surface water get contaminated. The surface water often from unintended releases from the ponds or truck accidents or things like that. We don't know all of the chemicals that are put into unconventional hydraulic fracturing fluid. This is a part of a table that lists several hundred chemicals that are used. This was derived from information submitted to a congressional committee a couple of years ago. And on the one hand, some of these chemicals are very common, methyl alcohol, isopropyl alcohol, but that doesn't mean that just because they're common, they are safe. And this table shows some of the same chemicals, a few more. But what I want you to pay attention to is the middle column. As many of you know, a number of chemicals that would be regulated by federal regulation in other industrial processes are not regulated when those chemicals are used or occur in the context of gas and oil development. So what the middle column of this image shows is, for example, methanol, if used by some other industry other than the oil and gas industry, would be regulated as a hazardous air pollutant under U.S. law, but it is not because it's part of oil and gas extraction. Diesel, which is occasionally mixed, diesel fuel, which is occasionally mixed with hydraulic fracture fluid, is a carcinogen. In other settings, it would be regulated under the Safe Drinking Water Act, SDWA, and as a hazardous air pollutant, and on as you go down this particular chart. And there are at least these two and several more instances where pollution of groundwater by unconventional gas extraction is well documented in Dimock, Pennsylvania, and Parker County, Texas. This research, published by people from Duke University, Osborne et al., is, I think, the most precise in linking the methane in the water in certain wells to the methane that comes from deep underground. What you can see here on the bottom axis, the horizontal axis, is the distance to the nearest gas well. So the farther out you go to the right, the further away the nearest gas well is to the water well. And then on the vertical axis is the concentration of methane found in the water. And it's important to note that down here where those two lines come together, there are many wells, water wells, that were close to gas wells that had very little methane in them. But it's also important to notice that the closer the wells, the water wells, were to gas wells, the more likely they were to have methane in them. And then the other thing that the Osborne and colleagues did that's so important is when leaves fall in the woods, a deer dies in the woods, when those organic materials start to decay, they can produce methane, and they can produce methane that can get into surface water or into groundwater. But methane that has been produced over the last decades or hundreds of years has a different carbon isotope in it than does methane that was produced hundreds of thousands and millions of years ago. And that's the kind of methane that comes from deep underground. And what Osborne and colleagues did was that they documented that this methane in these water wells was ancient methane that came from deep underground and therefore was very likely to be associated with the unconventional gas extraction. Again, it doesn't tell you how the gas got into the well. Did it come up through that 1.5 miles of rock, or did it break out through a well casing? That we don't know, but it is pretty good evidence that this methane came from very far below the surface. So I showed you this picture before when I was talking about air pollution, and now I'm showing you the same picture again to talk about water pollution. Why? Well, what happens when there's a huge rain or snowstorm and the level of liquid in this impoundment pond gets so high that it floods over the edges and runs down into the nearest creek, stream, or home? What happens when the wall of this impoundment pond deteriorates and starts to leak? Those scenarios set up the situation for likely contamination of surface waters. One of the reasons that we're told that we want to burn methane to produce electricity is because the burning of methane produces less greenhouse gases than does the burning of coal. And that in and of itself is a true statement. However, that in and of itself is not the whole story, and we need to look at the whole story. Methane, when released to the atmosphere, not when it's burned, but when it's released to the atmosphere, is a much more potent greenhouse gas than carbon dioxide. So as I mentioned, during initial flowback, several million cubic feet of methane may be released per day for several days. And then there's routine and continuous release of methane at the drill site, compressor stations, tank farms, and transmission lines. And all of this can contribute to climate change. And Tony Ingraffia, who's an engineer at Cornell, has done some calculations that suggest that getting methane from underground on net contributes to greenhouse gas accumulation and climate change rather than protecting us from climate change. These processes that go on during certain periods of time, the drilling, the hydraulic fracturing, are very noisy processes. They involve trucks coming and going at all hours of the day and night. Lights are on the pad all night long. When flaring is done, it's a very noisy process. There can be a lot of very nasty smelling chemicals like hydrogen sulfide and some of the volatile organic compounds, not methane, interestingly enough, but some of the other volatile organic compounds that escape from the pads. And the companies talk a lot about bringing new jobs to the area. And while there may be new jobs, those jobs don't usually go to the people who used to live in the area, but rather to transient populations who come, do the work for a couple weeks, go home, and then come back. And that can contribute to a lot of community disruption. We know that the sleep disruption that for any reason, whether it's from noise, light on pads, or any other reason for sleep disruption unrelated to unconventional gas extraction, can make learning difficult, can make concentrating and therefore driving difficult, working machinery very difficult. And there's a growing body of evidence that stress can adversely affect the cardiovascular, immune, and other systems of the body. So we know that there are a lot of chemicals that exist around, in, on, and are used by or produced by the unconventional drilling process: diesel exhaust, chemicals in drilling mud, fracturing fluid, flow back from underground, and that these are known to reach human beings either via the air and or the water. And while there is no data to document that there are widespread adverse human health consequences occurring as a result of natural gas extraction using high-volume slickwater hydraulic fracturing from long laterals from clustered multi-well pads, we do know that there are a number of hazardous chemicals used in and produced by unconventional gas extraction, and a number of very plausible and in some cases well-documented routes of human exposure. So I recommend that the drilling and energy companies need to be responsible for demonstrating that this drilling and gas recovery can be done in a way that minimizes the threat to human and ecosystem health. That has not been done to date. They should fund independent foundation to organize that research, as has been done by industry and others in topics like air pollution, as done by the Health Effects Institute, in oil and gas exploration, as has been done by the Western Interprovincial Scientific Studies Association in Canada. It is the responsibility, I believe, of the energy and drilling companies to reveal the full description of all chemicals used and the quantity of those chemicals to the public, and it should not be the responsibility of the public to fund the research to determine whether, after the fact, hydraulic fracturing and natural gas recovery from shale is dangerous. As I mentioned, I'm the director of the Mid-Atlantic Center for Children's Health and the Environment, one of 10 pediatric environmental health specialty units in the country. We educate health professionals, parents, school personnel, and others about topics related to children's health and the environment. This list is a list of some of the issues that we deal with in addition to questions about unconventional gas extraction. Excuse me. It is not an exhaustive list, but it does give you an idea of some of the kinds of problems that we tackle. I run the unit in Region 3, excuse me, but there are units in each of the other 9 federal areas of the country. Information about all of the pediatric environmental health specialty units can be found at this web address, and I'm happy to answer questions from the group online. Thank you very much.
Great. Thank you, Dr. Paulson, so much. Thank you for educating us on so many things, in particular about why children's unique physiology makes them so susceptible to chemical pollution. And also, it was really great to receive a comprehensive overview of the processes of unconventional natural gas extraction, in particular those technical and structural processes, and how these sources of pollution get generated. I think that was very useful to see that. And thank you also. It was great for me to see that you pointed out the different research studies that have been done, and to be able to get to understand how these associations can take place, and pointing out Dr. Lisa McKenzie's study assessing proximity to natural gas wells and the risk for birth defects. Dr. McKenzie will be speaking on June 2nd, so I'm sure she'll be talking more about this study that she's done and talking about the research that she's done at that time. So I will now turn and open this up to session, questions from our attendees. If you do have questions, please type in your questions in the chat box at the bottom of the GoToWebinar control panel, and we'll be answering those questions in the order in which they are received. So we already have our first question here, Dr. Paulson, and the question is from Rosemary Chuang, and she says, how can we get help to improve the health impact assessment process for Alaska? Many regulatory enforcement measures are lagging here. How should we assess existing infrastructure as a push to do things better if we have to deal with more changes in the NPRA?
The best resource for health impact assessments is on the Pew Trust's website. Aaron Burnham is a physician, I think he's a family physician actually, who used to work in Alaska and is one of the originators and one of the early people to explore the use of health impact assessments for looking at environmental impacts on health and communities. And he now is at the Pew Trust. So if you Google Pew Trust and then look under their webpage for health impact assessments, there's a lot of information about health impact assessments, about training programs that Pew runs at various sites around the country during the year, contact information for people at Pew, and should be very useful to the work that you're trying to do.
Great. I'm going to move now on to the next question from Eric Uram. He says, petroleum and coal have a suite of contaminants that can occur as gases, including many toxic metals like nickel and mercury. Are these also present in unrefined processed natural gas at levels of concern for workers and/or local residents?
The metals, to my understanding, are primarily in coal. And then when the coal is burned, it gets so hot that the metals go up in the waste gas from the burning of coal. So by and large, heavy metals are not carried in the gas stream from natural gas recovery. They may be in some of the liquid that comes back above ground in flowback fluid. So the shale gas, or I'm sorry, the shale rock is the product of an ocean that existed eons ago. And as that ocean evaporated, organic material fell to the bottom and created the shale gas. But of course, other things that had been dissolved in the water, the various salts, also then end up in the rock. And so when you put water back into that area again, it's not surprising that material that has existed as a very highly concentrated brine or as a solid is then liberated and goes into the water, which then flows back above ground. Not all of the water that's pumped down does come back up, but the brine that does come back up is one of the things that makes the management of the flowback water so difficult, because it's very hard to purify material, purify that water and be able to use it again. There are some systems that have been developed so that the water can be used maybe 2, 3, 4 times, but there does come a point, even in those systems, where it's so contaminated it must be then somehow or another taken off-site and disposed of. That can't be done in most commercial or public water treatment facilities, and so a lot of this stuff is pumped into underground storage wells where one hopes it will stay forever.
Okay, thank you. We have another question here from Denise Garat, and she says, what is used to produce the underground explosions? Are they using IEDs? Where do the explosive devices come from, and what is their capability?
You got to talk to a petroleum engineer about that one. I don't know the details. It's, to my understanding, it's small amounts of explosive that is introduced into the wellbore, pushed all the way down to the end. A plug is put into the pipe to contain the explosion, and a relatively small powered explosion is then set off. But I don't really know the details.
We have a couple more questions here, one from Irene Fortune, and she says, you mentioned concern about exposure during drilling wells and extraction from it. Compressor stations and gas plants receive products from many wells, operate 24/7 for many years, and it can emit hundreds of thousands of tons of volatiles and nitric oxide. So I think she's making a comment here. But maybe, I don't know if you want to comment about the exposure.
Yes, I did mention that the pipelines, the compressor stations, the drying stations are a source for release of these materials to the general atmosphere. And the compressor, she's quite right in that some of these compressor stations and other processing sites are run by diesel generators, so you're getting the release of diesel emissions, that they run 24 hours a day, so that if they are near school buildings, homes, etc., there can be quite a bit of disruption of the surrounding community from the noise pollution that occurs with these parts of the process that go on off the pad site and for long periods of time after the well is completed and the gas is being recovered from underground.
We have one last question here from Rich Kaplan, and he says, what is the increase in air pollution at site versus various distances out?
That's going to depend upon local geography. Is the site in a valley? Is it on a hilltop? It's going to depend on prevailing wind patterns. So if the wind generally comes from, say, the northwest, then that's going to blow stuff more to the southeast. So that's a question that can only be answered with information about the specific locale. But that being said, There is one valley in the west where there's essentially no industry other than hydraulic fracturing. There's very few people, and yet what once used to be pristine air now has ozone alert days as a result of the air pollution associated with the trucks, the generators, the release of materials from the wells, from the compressor stations, et cetera, et cetera. So not different in some ways from, Los Angeles, New York, Philadelphia, Baltimore, or other cities that experience ozone alert days.
Great. Thank you. So thank you, Dr. Paulson. Again, thank you so much for being with us today. And thank you to everyone for your questions. Feel free to reach out to us if you do have additional questions. So we will need to go ahead now and wrap up. We hope to see you again next week when we are joined by Katie Huffling. She's a certified nurse midwife and director of the Alliance of Nurses for Healthy Environments. Katie has experience with pregnancy and environmental health problems, and she'll be speaking about the susceptibility of women and fetuses during pregnancy in connection to unconventional natural gas drilling. So please check out our website and register if you haven't already done so. And please feel free to reach out to me should you have any questions. I'm happy to also share questions with Dr. Paulson as well. So feel free to reach out. And we will be posting a recording, and the recording will have the slides as well. So we will also be administering a survey poll via email as we did last week. So we really appreciated everyone's responses. We hope that people will take a few minutes to provide some additional feedback for us again. So thank you again for joining us, and we look forward to seeing you hopefully next week. All right, take care, everyone, and have a good day.